Okay. Hello everyone, we are at ICM 2025 and I am with Thorsten Gherke. I know you very well, but could you please introduce yourself a little bit?
Yeah, sure. As you said, I'm Thorsten Gherke from Hamburg, northern part of Germany, and I'm working as a medical director in the endo clinic in Hamburg, which is a very highly specialized hospital, which is focused on joint replacements, where we are doing about 8,000 implants a year, and additionally some other kind of orthopedic surgery, but it's extremely high specialized. And we are focusing historically since more than 50 years on the topic of periprosthetic infections.
So I want to focus on the infection. So why does the infection matter for you?
Yeah, because I'm a kid of the endo clinic, and the endo clinic, as I mentioned before, is historically very focused on this kind of complication, which is actually the worst complication in the field of joint replacements. And it's not only a catastrophe for the patient, which is really unbelievable, but it's really a catastrophe for the surgeon as well. So we have to find solutions, not only to protect the patient, of course, and save the patient, also to protect ourselves for being harmed by this kind of complication.
I'm excited to ask you this question. What ICM means to you?
ICM means for me a lot, of course, because Jay Parvizi and I founded the ICM about 13, 14 years ago. So we did the first one in 2013. And this became a quite important brand in case of periprosthetic joint infections. And our mission that we had initially was to help these kind of patients who are suffering from this unbelievable serious complication. And so we started it. We started the mission 13 years ago, and now we are here on the third one. So it means for me a lot, more than a lot. It's one of my most important topics in my professional life.
Do you want to talk about a little bit a growing process of ICM, and did you accept it to reach this year?
The global process. The global process was quite interesting. So when Jay Parvizi and I came to the conclusion that there is no evidence in the field of treatment, diagnostic, and clinical pathways of periprosthetic joint infections, we asked ourselves, if we cannot really get evidence, then at least we should get consensus. So that was the start, and the years were running very, very quickly. After the first one in 2013, everybody asked us, when do you repeat it? And we repeated it in 2018. It's a huge amount of work. And then we said, okay, let's see what happens. And then many, many people all over the world were really forcing us to organize another one, and that's why we are here. It's 2025, and it's probably it is of course the biggest one and probably the best one.
When you compare to other congress or meetings, what's the difference of ICM?
The difference of ICM is quite clear, because the difference is the involvement of the participants, of the delegates. We call them delegates, because every single person who is attending this meeting is involved regarding preparation of the meeting, presentation, and at the end voting about the results. So it's a very open meeting which is open for discussion, but everybody, really everybody, is extremely intense involved in the whole process of the ICM, and that's the difference.
Would you like to say something about your feelings or your thoughts of ICM?
Yeah, I think, okay, I'm biased. I'm biased because I'm one of the co-founder with Jay Parvizi, but I think the ICM is probably these kind of meetings, consensus meetings, probably are the future in medicine, because we have to give our colleagues globally, worldwide, at least a clue what they should do, and we should give them recommendations based on the literature, of course, to help them in their treatment, and at the end it's just for the patient. So the most benefit is really targeting to the patient, and I think that makes it so special, that makes it unique, and yeah.
As a final question, is there anything you want to say?
Yeah, I want to say that one of the reasons, I know you are from Istanbul, one of the reasons why this meeting is so successful and why we have so many attendees is the city of Istanbul. And I'd like your fantastic city to host us in this special, great way.
Okay, thank you for your being here. Thank you for your time.
It's a pleasure.
My pleasure, actually. Thank you so much.
Thank you.
Yeah.
Okay.